Hi, I'm Mike Erlandson, Program Director for the Swedish Family Medicine Residency Program in Englewood, Colorado. We're a small community-based program with 6 residents per year in the South Denver suburbs, and we're part of the HCA healthcare system. We've been going strong for almost 30 years now, training full-spectrum family physicians in the beautiful Rocky Mountains. I'm going to let a few of our faculty and residents tell you more about the facilities where we get to work and the program in which they train.
I'm Callie Woodall, and I'm a resident at Swedish Family Medicine. I chose this program because truly I felt like this was where I belonged when I talked to all the people during my interviews, and I felt like this was going to give me the best training to be the family medicine physician that I want to be. Our outpatient continuity clinic is on the hospital campus and was newly built in 2021. We are proud of the open design of this space, which allows collaborative interaction between all members of the team. We are lucky to have integrative care resources, including social work and behavioral health, available to provide an extra level of support. Dedicated space facilitates the full spectrum of in-office procedures, as well as obstetric ultrasound, point-of-care ultrasound, and osteopathic manipulation. The practice has a strong emphasis in providing medication-assisted treatment for substance use disorders, both in clinic and in inpatient settings. The longitudinal curriculum means that you will have more consistent contact in clinic with your continuity patients early in your training and throughout your time here. You will also have the opportunity for community involvement working in our high school clinic and nursing home service. Some of the procedures that we do in clinic include joint injections, skin biopsies, Nexplanon insertions, IUD insertions, vasectomies, and POCUS.
Hi, my name's Carmen Vandal. I'm a family medicine physician. I'm one of the core faculty here at Swedish Family Medicine. I'm a Denver, Colorado native, and I did residency here at Swedish Family Medicine and decided to stay on as one of the core faculty. I've been here for 7 years and have really enjoyed it. A little bit about why I chose this program. I really liked the broad spectrum family medicine care that the residents got to practice in a lot of different settings: inpatient, outpatient, OB, pediatrics. And I had a great time in residency. And then when I was thinking about jobs, initially I was going to work in an outpatient federally qualified health center, and an opportunity came up to be one of the core faculty, and thought about it and thought about what I really wanted to, where I wanted to be in a place of practice, and realized that I was really supported as a resident by my faculty. I felt like, I had a place where I could call home and really felt like it was a family. And so decided to stay on as one of the faculty members. And I think we provide great care for our patients. I think we really care about our residents. And, living in Denver, Colorado is a great place to be, and really enjoyed my time being here as faculty, and hope you feel that way too coming to our program.
Hi, I'm Ross Tanik. I'm a resident here at Swedish Family Medicine. I chose to come to this program for residency because I did a acting internship, a sub-internship here as a medical student in my 4th year of medical school. Really enjoyed working with the residents and all the faculty. Great hospital, great program. Got to learn a lot while I was here then, and continued doing so in residency. The strong continuity in the program extends to the inpatient experience. Our inpatient service is resident-driven and staffed by our core family medicine faculty. The service is full spectrum, including care for our medicine and obstetric patients, as well as consultation for medication-assisted treatment for opioid use disorder. The team does table rounds for teaching and includes a night float schedule, and also 1 to 2 half days of clinic in the afternoon, which allows you to have great continuity with your patients. Residents have access to free hot food for breakfast and lunch daily, and a well-stocked physician lounge to keep you going strong. You will do all of your inpatient time at Swedish, as well as rotations with critical care, ER, general surgery, OB, and multiple other elective options.
Hi, I'm Michelle Koblenz. I'm a resident here at Swedish Family Medicine. And I chose Swedish because it's a large community hospital in a metropolitan area where I could learn about a lot of different conditions and people. I'd like to show you some cool highlights of being a resident here. Training in our community hospital allows us to be independent and work directly with our supportive attendings and other medical staff who are invested in our training. Our call room is large and cozy with rooms for napping, space to work and relax while on night shifts. We also have on-site spaces for exercise and wellness, which certainly help with finding balance during residency.
Hi everybody, my name is Grant Thomas. I'm a second-year resident here at Swedish. I'm going to talk to you a little bit about why I chose Swedish as a residency program and why living in Colorado is awesome. So I interviewed with Swedish like everybody else, and I actually just picked Swedish, a lot of different programs, cold turkey, but I had a really good interview experience. Specifically with talking with the co-residents, I really felt like it was a really safe learning environment and everybody got along really, really well. So just good vibes overall. And then obviously living in Colorado has been great. My wife and I love the outdoors, and Denver's really like a large metropolitan area with a ton to do outside of the mountains. So even if you don't like the mountains, plenty of stuff to do. The things that my wife and I love, there's actually a lake that we live close by, so lots of water activity. We love to go skiing along with a lot of my other co-residents, and there's a ton of breweries in the area too. So overall, the residency program experience has been great, and living in Colorado has been even better.